Hey everyone, welcome to the PTCB Prep Guide, your spot for simple, clear, and totally stress-free pharmacy learning. Today, we're going to break down one of the most important topics for your exam, the top neurology medications. We'll walk through the must-know definitions, the highest-yield drugs you are definitely going to see on the test, and some super simple memory shortcuts to help you crush it. So let's dive right in. Okay, so here's our game plan for today. We've got 5 key sections. We're going to start with the real heavy hitters for the exam, seizure meds, and then work our way through some other major neuro conditions. Then we'll wrap it all up with a rapid-fire review to make sure everything sticks. This flow is going to make it way easier to remember. All right, Section 1, and I really can't stress this enough, this category is extremely high yield for the PTCB. You are pretty much guaranteed to see questions on these drugs, so let's make sure we know them inside and out. First up, just a few quick basics. A seizure, as you can see, is basically an electrical storm in the brain. The drugs we use to treat them, we call those anticonvulsants. A lot of these work by boosting a neurotransmitter called GABA. Just think of GABA as the brain's brake pedal. It helps calm down all that extra electrical noise and stop the storm. Here are the big 5. You got to know these. Let's go through them. First, we have Phenytoin, brand name Dilantin. The key thing here is that patients need regular blood tests to check their levels. Next up is Levetiracetam, or Keppra. You will see this one all the time in the pharmacy. Then there's valproic acid, brand name Depakote, which has a serious warning about liver toxicity. Carbamazepine, or Tegretol, is interesting because it's also used as a mood stabilizer. And last but not least, Lamotrigine, brand Lamictal, where you have to tell patients to watch out for a serious skin rash. So the most important thing is to focus on these safety warnings, because that's what the exam loves to ask about. Just burn this into your brain. Depakote and liver toxicity, Dilantin and blood level monitoring. And a good rule of thumb for this whole class of drugs is they can cause CNS depression, which just means drowsiness and dizziness are really common side effects. Need an easy way to remember this core group? I gotcha. Just think PVCL. P for Phenytoin, V for Valproate, C for carbamazepine, and L for lamotrigine. PVCL. It's a super simple way to recall the top 4 for your exam. Let's move on to our next section. Here we're going to cover 2 major neurodegenerative diseases, Parkinson's and Alzheimer's. The exam is definitely going to expect you to know the main drug for each of these conditions.
So Parkinson's disease is all about a lack of dopamine in the brain. So the number 1 treatment, the absolute cornerstone, is carbidopa/levodopa, brand name Sinemet. Its whole job is to replace that missing dopamine. The other drugs on this list are helpful, but Sinemet is the one you absolutely 100% must know.
So how exactly does Sinemet work? Well, this little phrase explains it perfectly. Levodopa is the part that actually turns into dopamine, but it needs a little help getting to the brain. Think of carbidopa as the car that drives the levodopa safely to the brain where it needs to go. Car drives dopa. Carbidopa/levodopa. Pretty cool, right? Now, let's talk Alzheimer's. The key neurotransmitter here is acetylcholine, which is a big deal for memory. The most common drug, and I want you to put a big star next to this one in your notes, is donepezil, brand name Aricept. Aricept is one of the most frequently tested neuromeds on the entire PTCB. You should also know Memantine, or Namenda, and rivastigmine, brand name Exelon, which also comes as a patch. And of course, here's your memory trick for that top drug. It's so simple. Just think, RE remembers. RE for Aricept, and it helps with memory. Simple but super effective for exam day. Okay, moving right along to Section 3. This is kind of a mixed bag, covering multiple sclerosis, ALS, and nerve pain, also known as neuropathy. For the PTCB, you don't need to be an expert here, but you do need to recognize the key drugs and one really important classification. For multiple sclerosis, or MS, you might see drugs like Copaxone or Avonex. For ALS, maybe Rilutek. Now, the really important thing on this slide for you as a pharmacy tech is that high-yield note. These are almost always specialty medications. That means they often need refrigeration, special handling, and you won't find them in just any old pharmacy. That's your key takeaway here.
Now for 2 drugs you will dispense constantly, Gabapentin, or Neurontin, and Pregabalin, or Lyrica. They're both used for nerve pain, but there is one critical, must-know difference between them that the PTCB absolutely loves to test.
And here it is. This is a classic exam question, you guys. Pregabalin, brand name Lyrica, is a Schedule 5 controlled substance. Gabapentin is not a federal controlled substance. This difference in legal classification is something you absolutely have to know. If you remember only one thing from this section, please make it that Lyrica is Schedule 5.
Okay, on to our fourth section, migraines. This is a super common condition, and for the exam, you need to understand the big difference between two types of treatment.
So the main point here is this. There are drugs you take to stop a migraine that's already happening, we call that acute treatment, and then there are drugs you take every day to prevent them from happening so often. For acute treatment, the main class of drugs are the triptans, like sumatriptan, brand name Imitrex. For prevention, you might see drugs like Topiramate or Topamax. Knowing this difference is absolutely key.
And how do you remember which ones are for stopping a migraine? Easy. You take a trip to stop a migraine. All the drugs in this acute class end in triptan. Sumatriptan, rizatriptan. If you see triptan, think stopping a trip to migraineville.
All right, you have done the hard work. For our final section, we're going to do a high-energy, rapid-fire review of the absolute highest-yield brand and generic names we talked about today. This is going to be like flashcards for your brain. Get ready.
I'll say the brand name, you try to say the generic before I do. Ready? Let's go! Sinemet is carbidopa/levodopa. Aricept is donepezil. Namenda is Memantine. Imitrex is sumatriptan. Neurotin is gabapentin. Lyrica, that's Pregabalin, a Schedule V. Keppra is Levetiracetam. Lamoctal is lamotrigine. And the last one, Tegretol, is carbamazepine. Fantastic job!
Awesome job going through all those neurology meds with me. You're getting stronger and stronger every single day in your PTCB prep. To really make this stuff stick, go back over your notes, rewatch any section if you need a little refresher, and just keep practicing those drug names. You've totally got this.
So, which drug pair from today are you feeling most confident you'll remember on exam day? Let me know down in the comments. If this explainer helped you out, hit that like button and subscribe. We've got new lessons dropping daily to make studying just a little bit easier. You are building the knowledge you need, piece by piece. You've got this.